Hey, Pathlight community, Ruth Banta here. Today is Friday, January 15th. It's sort of a gray January day, so I decided to do another virtual background. So most of today's video is going to be about vaccines. But before I get to that, I want to remind people we are still in the surge of COVID-19 infections. Overall, the state of Massachusetts is at an 8% positivity rate. As a comparison, at the end of October, our positivity rate was less than 2%. And we are continuing to see cases of people testing positive in the Pathlight community. So we want to keep emphasizing social distancing and hygiene protocols. They are so important. These steps are critical to protect the vulnerable individuals and families we serve, your colleagues, yourself, and your family. Now to vaccines. I'm going to share with you what we know and what we are working on. And just to let you know, we are getting new information daily. So first of all, we encourage the entire Pathlight community to get vaccinated when they are able to. The vaccination is not mandatory for Pathlight employees or care providers. We think it's very important for public health, but what we are offering is the availability for folks to get the vaccine through Pathlight. In a recent survey we did earlier this week, 84% of the respondents did say that they were planning on getting the vaccine when they were able to. To help facilitate the Pathlight community getting vaccinated, we are offering partnerships. We're offering clinics in partnership with Genoa Pharmacy, and we're vaccinating the Pathlight community according to the priorities that the Commonwealth of Massachusetts has set. So for our first clinic with Genoa, we are starting with congregate care, which are our group homes with the individuals and staff who work there. And we are working on getting vaccines for the next groups that are in priority one, who are the individuals and care providers in family-based living and the individuals who receive direct services from family support and the staff who deliver them. Here's a little more detail about our efforts. Genoa Pharmacy has secured the Moderna vaccine for individuals in our group homes and the staff in the group homes. We are in the process of confirming dates with Genoa to offer the vaccine to the individuals and staff. They will be going to our group homes to give the vaccines to people who are there. And we will also be offering one-day clinics in Greenfield and in Springfield for the staff who are not able to get vaccinated when Genoa was at our residential homes. Once we have those dates set, which should hopefully, we should have dates, we hope next week and the following week, but as soon as we know, we will reach out to you about what the steps are around appointments and consents and checklists so that if you want to get vaccinated, you will have all the information. We have already reached out to the guardians of the individuals in our congregate care settings. And we are working with Genoa to obtain vaccines for the next Pathlight community members who are in priority one as defined by the Commonwealth. And those are, again, the individuals and care providers in family-based living, as well as the individuals who receive direct services from family services and the staff who provide them. Once we understand how much vaccine we are able to obtain, we will set up these clinics and reach out to you all. We know everyone would love certainty and certain information now to know when they are able to get the vaccine and how that will happen. And we will share that with you all. We will communicate as soon as we know. But just to let you know that being able to offer the vaccine to the entire Pathlight community who wants it is what we are working on within the constraints of vaccine supply and the Commonwealth's priorities. If you have questions, feel free to send them to info@pathlightgroup.org. We did send out a letter earlier with information earlier this week, and we have gotten questions from people. So we are compiling those questions and the answers as we know them, and we will send them back out to everyone early or mid next week. Also, as the state progresses with vaccine distribution, over the next weeks and months, Pathlight will not be the only place where you can get the vaccine. We expect that there'll be many more places where folks can get the vaccine as the state rolls through its priorities and phases. Right now, if you have the opportunity to get the vaccine through another employer or because of some specific risk factors, please do so. Don't necessarily wait for Pathlight. Some of the things you can do now to prepare is, if you have questions about the vaccine, educate yourself. As I said earlier, this is a voluntary vaccine, so you all need to make the right decisions for yourselves. There are links to information sources in this email. These are the same ones that were sent out earlier this week. And if you have questions about the safety of the vaccine that are specific to you, talk with your primary care provider to have that discussion so you can make an informed decision. So again, if you have questions, please feel free to send them to info@pathlightgroup.org, because if you have that question, probably other people do as well. And stay tuned, there'll be lots more information coming out. And lastly, I do want to just remind folks of all of those really important protocols we need to do, because although we're looking at being able to roll out the vaccine, we are still seeing a lot of virus transmission. So if you have symptoms or are exposed to someone who has tested positive or has symptoms, please call your supervisor before you come to work at a specific location. Wear a face mask, maintain social distancing as best you can. Follow the governor's orders about limited indoor and outdoor social gatherings. That order has been extended to January 24th. And of course, wash your hands, but you'll get the whole wash your hands things at the end. These are so important to protect you, the individuals we serve, your family, your friends. We're going to get through this together, folks, but we still have a ways to go. So thank you all for all you're doing. December was hard. January is hard, and we're only halfway through the month. So hang in there. Be well. Be strong. Take care of yourself. You are important to many, many people. And lastly, here it comes, one of my favorites with these lovely sunset and mountains in the background. Wash your hands. Thank you.